Hey guys, Dr. Blythe here with Expert Spine Care. I'm going to start off with some little 5-minute videos about surgery, things to expect. We're going to be rolling these out over the next several weeks to months. First topic of today is stage surgeries. Stage surgeries, what they are, what that means, why do I do them, and what are the benefits of staged surgeries. Stage surgery is just basically that. It means that we're going to do one part of the surgery one day, and we're going to do the second part of the surgery another day, i.e. we are staging day one, day two. And the reason why we do staged procedures is quite simple. A lot of the surgeries that we do, some of them are a little bit more complex, some of them are a little bit more long in duration, and we stage these in order to kind of break up those days so that the patient who's having the surgery doesn't necessarily have all their surgery in one day and undergo these very lengthy, long lumbar procedures or cervical procedures or whatever it is. Now, staged procedures can be anything from cervical, lumbar, thoracic. It doesn't really matter. It just means that the plan for that day, day one, is to accomplish a certain amount of goals, and the plan for day two is to accomplish the rest of the goals so that your entire surgery is done over 2 days as opposed to one really long day. Now, why do we do staged procedures as opposed to just doing everything in one day? Well, sometimes it has to do with the logistics of the operating room. When we are trying to fuse you from one position, i.e. you're laying on your back for the first procedure, the time it takes to actually flip you and put you on your side or even on your stomach actually adds quite a bit of time to your operative day and the anesthesia. For example, if I do the first surgery with you laying on your back and then I try to flip you with you laying on your stomach, that involves actually bringing in another operating room table, taking the old operating room table out, getting a crew of people to pick you up, flip you, and position you. It is the equivalent of basically doing a whole nother surgery. It's easier to bring you in with that operating room table and everything assembled in the operating room ready for that procedure. The second reason why we do it is to decrease your operative time. Anesthesia has some unwanted side effects, nausea, vomiting. Sometimes patients can have heart attacks on the table. All these things, when we put you to sleep with anesthesia, stresses the body. And the longer I can stress the body by doing the surgeries that I need to do, the better that you can do as a patient overall. Now the question is, do staged procedures in and of themselves put you at higher risk? Actually, no. They actually decrease your risk. They do kind of tend to increase your overall length of stay in the hospital because we're breaking the surgery down into 2 days. However, with minimally invasive techniques, quite frequently after the second procedure, if patients are doing well, they're eating, the pace control, they're walking the halls, they go home the day after their second procedure. So that's part of the reason why we do the staged procedures and what that means. Now, how often do we do the staged procedures? Staged procedures are basically done for fusions in long, complicated cases. Sometimes, for most patients, the run-of-the-mill lumbar or cervical fusion, the stages are basically do all the fusion from the front, either through the neck or all the fusion through the lumbar spine, and then to bring you back the next day for the screws and the rods and the decompressions and any hardware that needs to be done at the back of the body. How often do I do it? And we do it for mostly cervical, thoracic, lumbar fusions. That doesn't mean that everybody's going to get a staged procedure. That just means that there is more than 50% of lumbar fusions or cervical fusions have to get staged procedures only because it's better for the patient and it's better for the logistics. So that kind of wraps up why we do staged procedures. The staging just means that we're taking certain pieces of your entire surgery, breaking it down into 2 days to decrease the length of your anesthesia time, to have some better logistics because of the time it takes to turn people and reposition them. That's the reason why we do staged procedures. Quite common in the industry that I work in, and better for the patients and better outcomes as well. Thanks for tuning in to Expert Spine Care. We're going to be rolling out some more of these videos over the next couple weeks and months, and hope to see you in my office. If you have any questions, certainly call us or get in contact with us at expertspinecare.com. Thank you.